Today, I want to discuss the importance of the visual field test. What we're measuring in this test is the peripheral vision for each eye separately. It is an extremely important test. When we're measuring that, we want to see if there's any problems not only in each eye, but if there's a problem that might involve the brain. I've had 2 such instances occur within the last few weeks. The first person came in, said he noticed something over here, but he wasn't quite sure what it was. So we did the visual field for each eye, and sure enough, there was some missing vision way off to the side here. So we immediately referred him, and what was found is that he had the beginnings of a detached retina. And the surgeon thought it was important enough to do surgery immediately on him, and this could have possibly saved his vision within that eye. The second patient that I want to discuss is more intriguing. Here's an individual who came into the office complaining of headaches and complaining of blurred vision, which most of my patients come in with anyway. When we did the visual field in each eye, we noticed a defect. The exact defect occurred in each eye while each one was covered separately during the test. This indicates the problem is within the brain and usually is the result of one of 3 things: an aneurysm, a tumor, or a stroke. In this patient's case, it was found out through imaging that she had an aneurysm, so immediately surgery was performed. On the operating table, the aneurysm actually ruptured. The patient lost vision in one eye, but fortunately, the surgeon was able to save her life. She was only in her 40s. She came in a few months later with a bowl of fruit and said, "Thank you for saving my life." Because the surgeon relayed to her, says, "I don't know who this person was, or we didn't know that optometrists do this type of testing, but go ahead and thank him for saving your life." It was really neat to see that. The importance of the visual field can't be underestimated, so this is why we perform it on every patient. Let me show you the instrument that we use to actually take the visual field of the patient. This is a visual field analyzer from Humphrey. What the patient does is actually sits in this machine and has a patch over one eye, looking into the machine like this, holding a clicker, and every time he looks straight ahead, or she looks straight ahead, and sees a flash go off anywhere within this machine, they click a button. And that's simple. The testing normally lasts 3 or 4 minutes per eye, and we're able to come up with a pretty good diagnosis of what the problem is, if there is actually a defect within that eye.